So, despite the shared feature of low birth weight and short stature, the absence of asymmetry, lack of feeding difficulties, and suggestive body proportions make 3M syndrome the more appropriate diagnosis than Russell Silver syndrome in this child. Genetic confirmation would solidify this. Clinical features of 3M syndrome, including severe pre and postnatal growth deficiency, characteristic facies, including triangular face, mid-face retrusion, thick eyebrows, fleshy nasal trip and long philtrum, thick vermilion of the upper and lower lips, as well as generalized or distal joint hypermobility and prominent heels or pes planus. Judith Hall had nicely summarized 8 syndromes of short stature with a triangular face. The lower row all have prominent foreheads and small facial bones. Bloom syndrome, note rash in sun exposed area. Dubovich syndrome, short palpebral fissures, missing lateral eyebrows, and eczema-like changes on cheeks. Patients with floating harbor syndrome, they have short philtrum, bulbous nose with the broad base and low-hanging columella. And then patients with MOPD2, prominent nose, a relatively small head, and patients with Mulberry nanism, frontal bossing, flat bridge of nose and mid-face. Patients with Silver-Russell syndrome, the asymmetry and triangular shaped face with large forehead and small facial bones. Short syndrome, hypoplastic eye and dimple on the chin. And 3M syndrome, long philtrum, full lips, hypoplastic mid-face. Here are some good papers for further reading about 3M syndrome, and patients, generally speaking, they don't benefit from growth hormone. However, you might try it in prepubertal children and evaluate. Genetic evaluation certainly needed with counseling, a referral to physiotherapist for hypermobility and orthopedic monitoring for scoliosis